Okay, we'll continue on with our third section on Alzheimer's. This one focuses a lot on dementia. Communication, sorry. Communication is the process of exchange of information, sending and receiving messages. Communication occurs with words, drawings, pictures, and behaviors. We have verbal and nonverbal communication. Body language includes posture, movements, facial expressions, and gestures. Communication roadblocks with Alzheimer's. They will have trouble finding the right words. They may be using familiar words repeatedly or inventing new words to describe familiar objects. They easily lose their train of thought and difficulty in organizing words logically. They can revert back to speaking in a native language. They may curse, may speak less often, or more often relying on gestures instead of speaking. The best way to communicate is to identify yourself. Always approach the person from the front. Alzheimer's patients are not people you want to sneak up behind on. Call the person by name. Smile, look happy. You want to make sure you have eye contact before you touch them. That's very important. Some people get a lot of negative responses, and I feel like they're touching the patient before they make eye contact. Use short, simple words and sentences and look at the resident. Talk slowly and clearly. A lower tone of voice they seem to respond to better. Give one-step directions. Break complex tasks into simple steps. One question at a time, one subject at a time. I should add to that one person at a time too. You don't want two people trying to talk to them at the same time. That confuses them as well. Patiently wait for a response. Don't hurry them. Repeat information or questions as often as needed, and when you're answering the same way every time. Use signs, pictures, and gestures as needed. Avoid confusing expressions. Avoid vague words and emphasize key words. They're not going to understand some of the young slang talk that people use. Turn negatives into positives. Give visual cues. Avoid quizzing. Just asking a bunch of questions. Give simple explanations. Treat the person with respect and dignity, and be aware of your tone of voice always. And always pay special attention to your body language, because that tells a lot. 12 Minutes with Alzheimer's. That video is a good one to watch. I sent you the link on the news page. And that's it.